There's some surprising new guidance out this morning about how old you should be for colon cancer screening. The American College of Physicians is now raising the recommended age. And here to clarify things for us is Dr. Cedrek McFadden. He's a board-certified colorectal and general surgeon. Dr. McFadden, clarification is needed because this is a bit confusing. For years now, we've heard more young people are being diagnosed with colorectal cancer. So, as a result, they lowered the age for average risk to 45. And now this group is saying 50. What gives?
It's confusing, and it gives me a little bit of heartburn at the same time because we've had such a progression toward younger people accepting that challenge to be screened. We still know that more than 1 out of 10 young people are being diagnosed with colorectal cancer, and it's still a diagnosis that we see in older people, which led to this particular group saying, well, is there a really risk-benefit here, right? If we know we're finding less colorectal cancers in this group, how might we then screen them a little bit better? And so the concern that I have is that, are we going to then discourage people? Are we going to confuse people about getting the test?
So what is their recommendation is what? A colonoscopy screening every year starting at 50 instead of 45?
At the age of 45.
But many other, including the American Cancer Society, is saying 45 is the year.
Correct. And those groups are still saying that. And I imagine we're going to have lots of conversation about that in the upcoming days.
What would be the reason behind changing the age, other than there are fewer people in that group who get it? Because as Craig was pointing out, we've done stories in the last few months that said the number of young people getting it is actually improving. So give me some concrete reasons on why.
Well, it comes down to two things. I think cost, as we look at sort of the population cost versus the individual cost of caring for patients. Are we being responsible with the dollars?
So it's expensive to get the test?
It is technically expensive if you think about the number of people that are being tested, but it's also more expensive to have cancer and to have surgery and to have chemotherapy and radiation. So I think there's some backdialing we have to do. And the other bit is the benefit of doing the screening in these younger patients. We're thinking about time off from work, time off from their family. You know, how much time is it going to take them to recover from a cancer if we can prevent it, if we can catch it?
What is the bottom line?
Yeah.
If you're sitting here and you're 45, you've got one group saying you should start getting a colonoscopy every year. This group saying don't. Is insurance going to still pay for it? Should you just go ahead and do it? I mean, if you're sitting at home, what's the best practice here?
Yeah, so insurance takes their guides primarily from the United States Preventive Task Force, and they still give the recommendation at 45, okay? And these recommendations do not apply to people who are at high risk or people who have symptoms. And so those people, regardless of the age, they still get a colonoscopy. Bottom line is, talk with your doctor, have an individualized conversation to make sure that you're getting the right test at the right time for you. I'm turning 45 this year. I'm getting my colonoscopy.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.